Hi, welcome to the third video on schizophrenia. This one is about biological therapies, specifically about drugs. As always, all the information comes from the Pink Haired Girl textbook. This time we are on page 208 and 209. Okay, so we call drugs used to treat schizophrenia antipsychotics. So schizophrenia is a psychotic disorder and medication to treat this would be called antipsychotic medication. It can be given as a syrup, it can be given as a tablet, or it can be given as an injection. Injections are really helpful for doctors to give if they worry that the patient is not going to take their medication. There are two types of antipsychotics, typical antipsychotics and atypical antipsychotics. The typical antipsychotics were the old-fashioned drugs that have been around for a long time, and the atypical antipsychotics are the much newer drugs which have been developed. Okay, so in typical antipsychotics, the most commonly known one, which was developed in the 1950s, is called chlorpromazine, and it links to the dopamine hypothesis. It basically works as an antagonist in the dopamine system. Antagonists reduce the effectiveness of a neurotransmitter, and a dopamine antagonist blocks the dopamine receptors in the brain. So what it does is it blocks the synapse from absorbing the dopamine, which reduces the action of dopamine. So it reduces the levels of dopamine in the brain. When the patient first starts taking chlorpromazine, their dopamine levels will build up and up because the brain, the synapse cannot absorb dopamine, and so therefore there's excess levels floating around. However, the brain will try to counteract this by not producing as much dopamine. So the dopamine levels will increase, but the production of it will decrease. And then eventually the brain will try to balance itself out by reducing the amount of dopamine in the system. Chlorpromazine is also used as a sedative, which affects the histamine receptors. So if you've ever had hay fever and you've taken an antihistamine, antihistamines block that production and they can also cause you to be quite sleepy. So chlorpromazine has actually been used to sedate patients in hospital if they've been really anxious or, they're not settling down for the doctors. So you can imagine what it might be like for a patient taking chlorpromazine, that they're basically a zombie and they can't do very much because they're sedated basically. So you can imagine what it must be like to take that drug. Moving on to atypical antipsychotics, the first is called Clozapine, and that was developed in the 1970s, and that was developed to try to suppress the psychotic symptoms but reduce the side effects and also prevent them from being walking zombies. So Clozapine was developed in the 1960s, and then it was withdrawn in the 70s due to deaths of some patients with agranulocytosis. Agranulocytosis basically lowers the white blood cells in the blood, and therefore reduces the patient's level of being able to fight infections. It was then brought back in the 1980s because it was really effective for schizophrenia, but it can't be used as an injection. It has to be taken as a tablet because if they give it as an injection, it can cause these horrendous side effects of lowering your body's ability to fight infection. So patients who take Clozapine have to have their blood levels monitored and make sure that they're not developing agranulocytosis. So again, it's not, although it's particularly effective in treating the symptoms, it's not particularly a drug that you actually might want to take. Clozapine works the same way as chlorpromazine, but it also acts on serotonin and glutamate receptors, which improves mood and reduces depression, anxiety, and increases cognitive function. Fantastic. but you might lose your immune system at the same time. So because it enhances mood, it can be given to schizophrenic patients who are at risk of suicide. People with schizophrenia have a 30 to 50% chance of attempting suicide. So it's a great drug to sort of reduce those side effects. So clozapine, chlorpromazine, not fantastic drugs. In comes risperidone. This was introduced in 1990, and it was produced to be as effective as clozapine, but without those horrible side effects of, blood disorders and ruining your immune system. And it works like clozapine and binds to the dopamine and serotonin receptors. However, it binds more strongly to dopamine receptors than clozapine and is more effective in smaller doses. And evidence suggests that it leads to fewer side effects. So those are the 3 antipsychotic drugs that we use to treat schizophrenia. I hope that has helped and makes some sense. And if you've got any questions, just let me know or drop them in the comments. Thank you.